Hi everyone, thanks for joining. We're going to get started now. Just a reminder, 30 minutes, one question, one follow-up. Today we have Dr. Williams and Dr. Heyer here today, so I'll turn it over to them for some brief remarks.
Good afternoon. It's Thursday, and we'll give an overview of the trends for the past week. I'm pleased to have Dr. Heyer here with us, so to answer any questions related to areas of his jurisdiction. And so that's most helpful. And so I'll talk about our activities over the past week. So since Tuesday, we reported an additional 1,885 cases of COVID-19. That was 847 cases yesterday and 1,038 cases today. Of the new cases reported today, as in our pattern in the past, 376, and I'm saying most are around the GTA, 376 are in Toronto, 142 in Peel region, and 122 in York region. Our 7-day average for the COVID cases is 1,016. The weekly average is continuing the downward trend, and we've been observing this in recent weeks. And so that means that we've seen 1,264 for the period of February 5 to 11. We had 1,600 for the period of January 29 to February 4. And for the period of January 22 to January 28, 2,128. So you can see the trend downward is continuing week over week, and that is excellent. We're also reporting an additional 54 deaths, unfortunately, since Tuesday. While the number of deaths we're seeing daily is dropping, and that is also encouraging, yet there still are deaths are occurring. And we want to report today 44 deaths, and of course our condolences go to the family members. Today's newly reported deaths is the highest number we've seen in almost 2 weeks, and we have noted that accumulation over this time. But we're encouraged that other days it has been coming down and the total has been dropping. So our daily deaths has decreased now to 23, down from 32 in the previous 7-day period. In terms of hospitalizations and ICU admissions, there are 758 COVID-19 patients in hospital, and that is down from 883 last week. We have 277 patients in the intensive care unit, and that is a drop of 22 over last Thursday. With respect to our testing, while it was low over the weekend and over the holiday long weekend, and that's not unusual, we're up again today to 56,165 tests. They're in the process yesterday, with a positivity rate has been dropped down to 2.2%. As far as variants of concern, today we're reporting 359 confirmed variants of concern in Ontario. That's an increase of 40 from Tuesday's update. Of those that have been sequenced, 348 are the B117, and we've been asked by our microbiologists to not use the terms UK, South African, and Brazilian anymore because they're not really, in essence, from there. That's where they were identified. So we're going to use the numbers. The B117, 10 of the B135, that was the previous South African variant, and one of the P1, which is equivalent to the Brazilian. So we'll have to get used to the new numbers. Based on the analysis of the data, 80% of these variants of concern are either outbreak associated or close contact of cases. 12% have had no identified epidemiological link, and 7% are travel related. So, in essence, the data is going in the right direction. As with our data from Dr. Brown's modeling, we are in that descending part there, but we're watching at the same time our variants of concern. And we've seen that percent on the 7-day rolling average going up from a couple weeks ago to 6.7, up to 7, and then 8%, and this recently is at 9.5%. So we see this happening. The encouraging part is that we're not seeing that doubling every 7 to 10 days, as has been experienced in other jurisdictions who have undergone a influx of variants of concern. So we have a long way to go. And it's very important that we see in our data that even with Dr. Brown had shown with their mobility, people in Ontario had adhered quite well to keeping at home and less mobile, not as low as we did in March. So we still have to be really cautious, even as the province is going through processes of entering back into the framework. I want to make it very clear that it doesn't matter where on the framework you might end up, the personal precautions are and still are the key thing that makes a difference. And that means the masking whenever you're not out, when you're out of your household, whenever you can't maintain your distance of 2 meters, which we still want you to maintain. We want you to stay home whenever you can. Go out only for essential. Even if those services are now available, you should not do it haphazardly. You should choose to do it in a careful way, and those with less risk should do so. Because in the past, when you might have had an inadvertent activity around a person, if it was the old COVID, you might have got away with it. With the new variants of concern, the rate of transmission is so high that those that you assumed it was okay with are no longer under that assumption. You have to be protective even more stringently on the go-forward basis. Even if you're in a red zone, a green zone, yellow zone, or orange zone, it doesn't matter. The personal protection still has to be taken because we've seen some, even in our most remote areas, all of a sudden they have a variant of concern and we have an outbreak that occurs. So just because you happen to be in one of those zones doesn't mean you have no risk at all. And you have to continue to be vigilant and careful in your protection. Because if we do that, we will continue to bring down our numbers. And as it's seen, we are keeping the rate of increase of the variants at this time reduced, not eliminated. It's going up. It's not totally going away. We are making inroads on keeping the steepness of the curve at this moment under control, but that means that can change anytime pretty quickly. So we want to make sure we keep our guard and do all we're supposed to do personally as we take part in this time. So it's precarious, it's tenuous, and we're going to up-to-date with you as best we can with all these precautions in there. And so we are continuing to review the data information. Some have been asking questions about that. I work with the public health measures table. We review from the scientific table. We then look at the numbers. We then discuss with each of the medical officers of health. And then I make recommendations to the minister and then to the cabinet. The cabinet reviews those. And they make a decision on Friday. Because it's under either the EMCPA, the Emergency and Municipal and Emergency Protection Act, I always get the acronym wrong, EMCPA, or the Reopening of Ontario Act, which is in effect now, and that is the decision of Cabinet on Friday, and they make a decision or announcement what will happen at that time. So we are in those discussions right now, and we'll be have given some advice. We'll be given some more as we have more up-to-date data later in the week. So with that, I'm going to open up for questions from the media. And as Dr. Heyer wants to make a few comments as well. I guess so. Over to you, Dr. Heyer.
Thanks very much, Dr. Williams. Good afternoon. Always, as I listen to Dr. Williams and his key points, it brings a number of things to my mind. And just very quickly, looking at the outbreak numbers, over the last 7 days, approximately 150, which is certainly a decrease, and we're below 1,000 for the 30 days. But I still say that and think back to, well, we're still pretty close to 1,000, and those are new outbreaks being reported. So as Dr. Williams said, we continue to have infection, we continue to have spread. And I have to say it's really tough every day when we're here to listen to the fact that people continue to die. And that brings my other world together as far as the sadness that I've felt with families and recognizing again, and I've said it before, but I continue to say it, this really represents the seriousness of this illness. It represents the sadness that comes with it and the loss that many people have suffered, and we can never forget that. If there's anything we should remember, that's one of the things that we should be doing every day when we think about the things that we do. We need to be careful. We need to recognize the risk. We need to respect, recognize, and support those who are put in a position of risk because of their employment and because of where they live and because of the things that they do. And we can never forget those either. So I think with those points, I'll pass over to Alex to open up for media questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Your first question comes from Chris Herholt from CP24. Chris, please go ahead.
Good afternoon, doctors. Is Ontario considering changing its dosing guidance to prioritize giving first shots of the Pfizer vaccine to as many people as possible, given that the new data is showing that a single shot is almost as effective as receiving both shots?
So thank you for that question. We are absolutely, as we receive the doses, now that our supply is returning back to a larger number, we are absolutely providing the first doses as quickly as we can with a variety of different methods of delivery, and at the same time ensuring that we are budgeting and have availability for the second dose as the deliveries come forward. So it's planning to make sure the second doses are available. We have provided a 35-day dosing interval for between the first and the second dose for Pfizer for all but those that are over 80 and those that are living in seniors facilities, congregate care settings for seniors, as well as including long-term care homes, higher risk retirement homes, and First Nations homes for elders. All of those will maintain at the 21 to 27 day interval, but others will move to the 35 so that we have an additional 2 weeks of doses to go. But we strongly believe that 2 doses are required, and we strongly believe that 2 doses should be provided within the 42 days, as have been demonstrated from the clinical trials.
Follow up.
Doctors, 4 Public Health Ontario doctors published a study last week that predicts that the B117 variant will be dominant in the GTA before the end of February, and that there were dozens of highly probable B117 cases circulating in the GTA days or even more than a week before the first variant case was announced by public health officials on December 26th. Given this, were we too late in launching our screening and surveillance program?
Given that we were already doing some genomic sequencing or full sequencing, and we had identified the B117 in before Christmas at that time, we have been sequencing samples all since after the first wave into the second. So we had done almost 8,000 samples looking for variants all along. So I wouldn't say we were too late. We were doing it as soon as we could. That makes me ask the group who put that forward. I think it's an opinion. The data doesn't say that it was happening unless it was some other information they might have received. But our laboratory data doing our sampling did not identify it sooner, although we were looking for it. I think it's a logical conclusion as we did some sampling that we said it obviously was starting to circulate before the holiday season break, and that was identified then. As far as being the dominant strain, I believe our modeler already said that would be the case anyways, if not by the end of February, but well into March. As the other one drops, the variance of concern starts to increase. The B117 would be their choice of what they said might be the dominant strain. We have seen of the B135 as well. So I don't think it's I think between the two, I think we're going to see more variants of concern, whatever the number type it is, as compared to others as it continues to come down. But even now, they don't make up a high percentage, but it's increasing, as I said in my outset. But we want to watch that as we monitor this as it goes forward. And of course, we're dealing with a number of variants noted on a smaller number of positives week over week. And so the percentage becomes a different aspect in there. So we'll watch that, and I think most of what was being communicated was similar to what we heard from our modelers already, and I think they were just adding their opinions to the matter.
Next question.
Next question comes from Chris Glover from CBC News. Chris, please go ahead.
Hi there, doctors. We have a bit of a split request coming down from Toronto, Peel, and York. Toronto and Peel asking for an extension of the current restrictions. York is asking to move into red on Monday. Given what you're seeing already with the data, what is likely to be your assessment that you'll hand over to the health minister and the premier tomorrow for them to kind of tonight to make their final assessment tomorrow. What are you thinking right now?
So in the aspects there, I think you've touched on a good point. What we do is that we look at the data. We try to do it right up to as current as we can, not just one data point, but a number of data points in there. We also look what's going on, what the trend has been in the previous 7 to 14 days to see if it's trending down, whether it's plateauing, or is it starting to go up again. But most important, we have a talk with each one of the, in our areas of concern or change, to each of the medical officers of health to say, what is your read? How do you see it? And what's your perspective on the matter? So besides having received a letter from Toronto and Peel from Drs. Davila and Dr. Lowe, we have had a number of teleconferences with each of the three and asked them again, and what is their perspective on the matter? That's all part of it, informing our recommendations that we made preliminary to the minister earlier, and as we deal with that, final recommendations going up onto for cabinet decision tomorrow. In there. So these are a composite of different areas, and certainly the information and advice and direction of the local medical officer of health, including other aspects such as capacity, hospital issues, local outbreaks, are there major community spread? Many factors play into it that gives us a sense of not just these three you're talking about, but other ones in the province. And these are important discussions to have. So it's not just a rigid number that flips the switch. It's a combination of qualitative and quantitative information that feeds into it that gives us the best advice when we give that up to the minister and cabinet for decision making.
Follow up?
Okay, and the other thing that we had heard from Dr. Lowe specifically was when he was looking at, you already mentioned other communities as well. We know Durham's already in the red zone. It's looking like perhaps York, given how strongly they're asking to be in red, that they might go there too. And Peel's already talking about how he's worried about spillover into Peel region, given these other communities. So what's your concern level with the fact that even if you keep Toronto and Peel in the current restrictions, that if everybody else around them is in red and is in different restriction levels, that it could kind of erode the good work that's being done by keeping Toronto and Peel in the stay-at-home?
So one of the aspects is that when we do have our updates, we make sure some other health units and medical officer health say, what are the adjacent ones? And they're quite aware of that difference. Some say they have some concern, and some say, well, I think we can handle that. The difference between the red and you have to look at the difference, the delta between the red and the stay-at-home to see what are the areas that might be most problematic. And they would then deal with that. If they felt it was necessary to put a 22 order in, they could do so to limit it if there was an issue. The other aspect is we've been trying to say to people in the new one, whatever you are in the framework, we'd ask people not only stay at home, but we're trying to say stay local. And because it's the local group in the community that by that transmission rate going down are in a certain level, whatever it is, and have these extra facilities open. But that's for the protection and the use, I think, of the local residents primarily, and who have obviously been supporting those type of retailers or services and would want to do it in a safe and careful way, maintaining the distancing, maintaining the proper protocols, as would the retailers and people that are involved in that. But they're aware of those differences, and we'll deal with those if there was issues and concerns in particular in that. And of course, we're continuing to message that if you're in the stay-at-home area, that you would stay at home. And we still say, even after you're out, stay local and use those ones in your area, but use them judiciously, not abusively, and being very, very careful, because you can go back up into lockdown fairly quickly with outbreaks. So you want to maintain that as a community type effort and to protect that on a go forward basis if you have achieved that. So it's a joint effort, everybody pulling together, and we've seen success with that. We're going to have to keep doing that until the vaccines, as they're coming in now, keep rolling out. And so we're in a bit of a time frame here to try and match those together and to deal with that. So that's the situation, so thank you for the question.
Next question.
Next question comes from Matthew Bingley from Global News. Matthew, please go ahead.
Hi, Dr. Williams. Just on continuing on what Chris was talking about with the Peel and Toronto request, I'm just wondering what further data you need to actually inform this decision that you're making. You talk about the importance of public health units and their medical officers of health. Both Dr. Lowe and Dr. DeVille are saying that this is what they need, and they've just released new information in Toronto that there could be as many as 341 other variants on top of the case. So why is not listening to their opinion not an option?
As I said already, listening to their opinions is very important, and that's part of the information we have. Any updated information and metrics they may want to give before the decision's made, I'm fully open to that. That's what we do it for. We have the data too, and we may see some data that says, is this true? Is you got a big issue arising here? And say, no, the data was cleansed and clarified on that matter. So there's a back and forth to make sure, are we on the same page when we're looking at things the most up to date we can? So it's not an opinion gathered a week ago on closed door. It's a dynamic conversation, discussion, as I said before, because the opinions of the local medical officer of health is very important in the decision making and will continue to be.
Follow up?
Yeah, just on the topic of accountability, if you recommend that you are not in favor of what Peel and Toronto are requesting, and they find themselves facing another wave of COVID-19, possibly led by VOCs, and possibly another lockdown, who should ultimately be held responsible for that?
So it's very rarely that I will come to a situation where there's a strong disagreement. I think we'd have to say, here's the position, and have that discussion with the medical officer of health. I'm not talking in particular about Peel and Toronto. Could be anywhere in the province on that. I think if there is a increase in the cases suddenly, this is not a thing that MOHs locally can control. They can do their best to put it in place, so I wouldn't be blaming local MOHs. COVID is a complex disease, and the variants are moving in different ways. And so to say one has it perfectly planned out and they know exactly what's going to happen in 2 or 3 weeks from now, I would think is best presumptive. And so we have to be ready and nimble, and that's why if we do anything, we'll be quick to move up and to limit things in that, and then slow to respond to come back down again. So it is a dynamic process in there. Accountability is, in the end, the decision-making is, of course, by the cabinet, but the accountability is basically looking at our data and understanding that and portraying that information material to the public so they understand what the decision-making was and the reasons for it. I think Dr. Heyer has a comment to make.
Thanks, Dr. Williams. I think really valid conversation and questions, moving away from that just a little bit and recognizing and moving back to where Dr. Williams talked about as far as the framework and where the framework goes and the importance of recognizing the risk people may be taking, the situations they may be putting themselves into, the importance of understanding those that must go to work and supporting them and respecting them, but recognizing with greater variance and presence of those, there may be greater risk of transmission, and people need to be aware of that and thinking about that, and coming back to, and as hard as it is to hear and as hard as it is to do, to stay home and stay safe and save lives, important things to think about, and remembering all of these in a context of framework, but there is everybody doing the best that they can in the times that they can, and not going out to be doing shopping that isn't for essentials, and staying home as much as possible, unless going out for reasons that are required, and to see people or to be with people where there is a significant need for those who may be living by themselves in those sorts of situations. So I think it's such a challenging environment that we're living in and we're working in right now, but important to remember again that there is risk, that there is always concern, and that we always need to be thinking about that in the best way possible, and thinking about how to protect others who don't have the as easy ability to protect themselves.
Last question.
Last question comes from Colin DeMello from CTV News. Colin, please go ahead.
Hi, good afternoon. I'm asking about the risk of the variants. There are currently at least 2 outbreaks in high-rise apartment or condo buildings involving variants of concern. Yesterday, Peel's medical officer of health had said that they were investigating if transmission had occurred in elevators or hallways. How concerned are you, and how concerned should people be who live in high-rises that even a brief, everyday exposure could be a source of transmission with the new variants?
Yes, we've been not only with the cluster or the potential outbreak in Peel, and we've been getting advice on that. And actually, when I was coming down to this presser, they're having a further meeting and updating on the investigations that they've carried out there to look at with the wide testing. And I would say right now the evidence is not conclusive. But we need to hear the full data. So you don't want to make conclusions until you have the full analysis undertaken at this time. But they are continuing to analyze and look at that situation in the different types of settings where they're concerned. Part of that is with the variants of concern is that in Ontario, in Canada, I guess writ large, we want to say what is our experience with the variants? How is it working? Whether we had the outbreak up in Barrie, or we have the one in North Bay, or we have the one now in Peel and other ones, we'll be informed by those investigations to understand how its transmission moves, how it's concerned, how it's undertaken, and what the risk factors are. So all things are possible, but we want to make sure it is certainly backed up by evidence and with full investigation before we make any conclusions. So we've appreciated all the work that Peel is doing in that regard, and what the work at the Dr. Cherico has been doing in North Bay, and also what in the past that Dr. Gardner has done in Barrie is all added to our increasing knowledge and I would say expertise and understanding how these different ones, whether the B17 or now in this case the B135, how it's moving and how it affects people in different settings. So we hope to give some report to you in the near future when we have the final analysis, and I'm sure Dr. Lowe will be making some announcements in that accordingly.
Follow up, and this is the last question.
Thank you. Dr. Davila yesterday said that she is the most concerned about COVID-19 now than she has ever been during this entire pandemic. And she suggested that the number of variants that have been identified so far might just be the tip of the iceberg. I'm wondering, Dr. Williams, if you shared that assessment.
I think there's many days where this, I'm trying to think of all the ones. I remember certain days in the first wave when it was really unfolding quickly. It was very concerning. It's when we see things changing and we're not really sure of how it's going to go. I wouldn't say that there's one time I'm really concerned and the others I'm not concerned. There's concerns all along when I have major outbreaks in long-term care facilities and deaths occurring with certain vulnerable populations and groups. When there's something happening, as we had in the spring with the temporary farm workers, very concerned about that. And where's that going to go? Our concerns about travelers coming in and how we're going to handle that. So there's many concerns. So I wouldn't say there's one time when I'd say this is it and the rest aren't concerning. And I don't think Dr. Villa was meaning that either. I think this is the moment because with the variants of concern and their presence, where's that going to go? Because both Toronto and Peel are our most urban dense areas in the province. And because of the transmissibility and closeness, she wants to be concerned that she's on top of that and keeps the limitations as best she can to keep it under control because, after all, she's responsible for over 3 million population, and that is a major issue. So I can understand her level of concern, same as it's my level of concern too. But there's other health units in smaller areas, including sometimes remote First Nations, I'm very concerned about when there's an outbreak there because the remoteness from healthcare and services, it would be very upsetting. And that's why I'm glad that the immunization, the vaccination program with remote immunity is taking place as quickly as we can. So there's many areas of concern that I have, not just, I know Dr. Villa's concentration is Toronto, mine is Ontario-wide, and each jurisdiction has its own area where I'm concerned about that could be implosive and problematic, especially with these new areas of variants of concern. So I comprehend her concern, and I think by that it means focus and concentration and doing all we can to deal with not only the concern, but to take actions and steps to manage that.
Thanks, everyone.